when they were pharmaceutical funded studies, which they mostly are, they only print or publish the ones that are positive. Congress actually in the States changed the law. So now they have to be published. They don't have to be in a journal. They can be buried somewhere. But absolutely, research came out about 10, 15 years ago that our antidepressants don't work much better than placebo, which means, there are a lot of other things we can do to help our patients. Exercise, nutrition, mindfulness are all very powerful tools that probably work just as well. And if we integrate all of them, then we can really help.
Welcome to the Emil Barna Podcast, where in episode 2, I will be interviewing Dr. James Greenblatt. Dr. James Greenblatt is a pioneer in the field of integrative medicine, and he's treated patients since 1988. After receiving his medical degree and completing his psychiatric residency at George Washington University, Dr. Greenblatt completed a fellowship in child and adolescent psychiatry. He currently serves as the Chief Medical Officer at Walden Behavioral Care in Waltham, Massachusetts, and serves as an Assistant Clinical Professor of Psychiatry at Tufts University School of Medicine and Dartmouth College Geisel School of Medicine. Dr. Greenblatt has lectured internationally on the scientific evidence for the nutritional interventions in psychiatry and mental illness, and he's the author of 7 books, including Finally Focused, the Breakthrough Natural Treatment Plan for ADHD. And this is a book that we will be focusing on today. He's the founder of Psychiatry Redefined, an educational platform dedicated to the transformation of psychiatry. In our chat today, we talked about ADHD in kids, different nutritional interventions, and what to add, what to take away from a child and adult's diet, how ADHD can affect relationships between parents and between romantic partners, as well as different drugs, including methamphetamine, and how that interacts with the brain in the case of ADHD. So keep tuned and we'll get right on into it. Hello, James. Thank you for joining us here today on the Emil Barna Podcast. And I just want to say, thank you for agreeing to go through with this and setting up and talking a little bit about ADHD as it applies in children as well as adults. I just want to ask you a few, for those who might not be familiar with your name, would you mind giving a bit of a background about who you are and how long you've been working in this demographic?
Sure. I'm a psychiatrist, child and adult, so board certified in the States, and I've been practicing for 35 years. So I traditionally trained, but early on in my kind of practice, I realized that medication were not the answer. And as a child psychiatrist, most of what you see is ADHD, and started looking at a more integrative, holistic approach, and been practicing what I call a functional medicine, integrative medicine approach to ADHD for over 30 years now.
Wow. And for those, because these were terms that I hadn't come across until I started reading your work, integrative medicine and functional medicine. Do you mind, or functional psychiatry or integrative psychiatry? I wonder whether you can make that distinction between traditional as well as the integrative types of medicine.
Sure. I mean, that's kind of a big part of my life now, is helping people answer those questions. So traditional psychiatry is based on a model of treating symptoms, symptomatic based medicine. If you're depressed, you get an antidepressant. If you're not paying attention, you get a stimulant for ADHD. Same with any other diagnosis in psychiatry. A functional medicine approach looks at the underlying cause. So it's really a root cause assessment. So individuals for depression, you might have low thyroid, you might have low B12, you might have suffered a trauma or a loss. There are hundreds of reasons um, infection, COVID. I mean, there are many, many reasons, but our field of psychiatry, my field, doesn't address or look at the root cause. So functional medicine looks at the root cause, and integrative is a term that used to be called complementary, alternative, and that's where we're looking at, mind body approaches, looking at acupuncture, looking at other kind of treatment modalities that can be integrated into a traditional model. And my kind of life and practice and educational mission is to tell professionals and consumers that you need all the above. We can't I haven't thrown away my prescription pad. We do need functional and we do need integrative.
What got you to take a more holistic approach compared to many of your colleagues in the medical field?
I actually went to medical school, thinking I could solve the world's problems with brown rice and kale. So I actually went in with that mindset and came out a psychopharmacologist. I mean, 9 years as a child psychiatrist, I was brainwashed. And so I very quickly, went back to the roots and why I went into medicine.
Wow. And one of your, I can't remember when it was published, but relatively over the past few years, you published this book here, Finally Focused. And the subtitle is A Breakthrough Natural Treatment Plan for ADHD that restores attention, minimizes hyperactivity, and helps eliminate drug side effects. You take a very functional, if I've got that correct, approach to addressing ADHD, and it doesn't get rid of medication, but it kind of has a more holistic, I mean, to use that term again, more holistic view. Can you tell us a little bit about the structure of that book and what kind of lay behind all the thoughts that led to that?
Sure. I mean, the material in the book I've been practicing and talking about for most of the 30 years. I remember giving lectures in the 90s, but we didn't have a lot of research. And so, I learned from clinicians and I read when I started. But over the last 10 years, a lot of research came to kind of support everything. And that's why we put it together in a book. And essentially, we kind of wrote it as a very simple approach for parents, even though the program is just as helpful for adults, and kind of described a treatment model called the plus minus plan, based on the fact that not every individual with ADHD has the same biochemistry or underlying problem. And we just went through and listed things, meaning plus what you should add to one's diet or lifestyle. And that would be things like magnesium and positive feedback and other nutrients. And then the minus are the kinds of things that might have to be eliminated. And that's things like heavy metals and copper and lead. And so it's a very simple approach that we kind of articulated for parents or individuals with ADHD so they could follow it.
One of the first things that you mentioned in terms of the pluses was magnesium. Do you want to give a bit of a background on the research behind magnesium for ADHD? I do remember you mentioned the vast majority of people who have attentional issues have a deficit in magnesium. So do you mind going a bit into that?
Sure. Yeah, I mean, I think it's one of the few things, and that's why it's one of the first chapters in the book, because I think it's the most important. And there's some research. A lot of there's not as much research as we would like in terms of nutritional interventions in mental health. But in our practice, looking at magnesium levels in blood and hair, I have found it over 90% of individuals with ADHD are deficient in magnesium. So it is critically important that people supplement it soon, early. And it's one of the few supplements we recommend without any testing. It's simple, it's safe, and it can really help with anxiety, sleep, as well as hyperactivity.
And what is magnesium for people who might not be aware of that?
Sure, magnesium is a mineral, meaning we obtain it from our diet. We can't make it. So we can't live without it. And it's, at least in the States, we were getting like 400 to 500 milligrams, 75 years ago from our diet. And now with processed foods, we're getting half of that. So many people aren't getting the magnesium that they need. And there are hundreds of enzymes in the body, meaning for the body to work efficiently, for the brain to function, for our stress response to function, it needs adequate magnesium. And some of the first symptoms are common, things like constipation, insomnia, anxiety, irritability. So magnesium is probably the most common nutritional deficiency that I see in a nutritional psychiatry practice.
So it's much, much wider than just ADHD.
Absolutely, yes. And I think for people new to nutritional psychiatry, if they had one thing to learn, to read about, I would recommend magnesium because there's plenty of good information out there and it's that important.
When it comes to supplementation, does any magnesium off the shelf, confer the same benefits for adults and children alike?
Absolutely. Magnesium is inexpensive and there are many different forms. Most of us know magnesium as a laxative, right? Milk of magnesia. So at very high doses, magnesium oxide is the form. It works as a laxative, but with different forms. So I recommend if someone's supplementing for ADHD, they don't take magnesium oxide. They look at other forms of magnesium, and it's very simple to take unless somebody has kidney disease. It's very simple and safe, and people can notice a difference sometimes in 2 to 4 weeks.
And it seems that there are, I think, at least 4 or 5 different types of magnesiums. Yeah, have I got that one right?
Yeah, there's magnesium glycinate, citrate, sulfate, threonate, different carriers. The only thing I think be important for your listeners to remember is try to avoid oxide because that is the laxative. Most of it's not absorbed. Much of it, although there are doctors for people that can't afford supplements that recommend taking just a small amount of milk and magnesia. You'll get a little magnesium.
You mentioned 75 years back, we were getting the adequate dose of upwards of 400 milligrams. Have I got that one right?
Yes, I mean, because, we didn't process grains, we were eating whole foods, and a lot of magnesium is in our green vegetables. Our chlorophyll molecule is magnesium is the center of everything that's green in the plant world. It's in the husks of grains. So it's a important component of food. The problem is that, we in the farms, we never replaced magnesium. When we put fertilizer back in the soil, we keep depleting magnesium from our vegetables in the soil, but we don't put it back in. Oh, wow. So there's a depletion of magnesium in our soil as well.
I didn't think about that one. That's interesting. Okay, you touch on magnesium. You also touch on a number of other pluses, things like omega-3 fatty acids. And I think you talked about nutritional lithium, which was quite interesting because the only other form of lithium that I was aware of was the bipolar medication. And you mentioned a few other ones. So tell me a little bit about the other pluses in your treatment model.
Sure. And again, the magnesium, I think, is perfectly appropriate. And again, most patients, but like the omega-3s, the essential fatty acids, what's in fish oil, people read about it for ADHD and they start giving it to their kids or they start taking it. And it's certainly safe and it can be helpful, but not everybody with ADHD is deficient in omega-3s. Some are, and there's some signs we could look for, or there's tests that we could do. But many kids, and we have research to support it, are deficient in the omega-3s, and supplementing with fish oil can be helpful.
Hmm. Any?
The
Oh, go on. Sorry.
No, it's going to go to lithium, but you have
I,
questions on the fish oil?
I guess just on omega threes, are there any particular dosage amounts that people who are deficient in omega threes would benefit in?
Well, I think there's not a lot of good research. I think there is. I have a number that most people getting up to 3 grams a day total of the EPA and DHA is probably sufficient for adolescents and adults. 1 to 2 is fine for kids, and I would do that for 3 months to see if there's any difference. We have an expression: it takes 3 months to change your oil. The brain is mostly made up of fat, and it does take time, so it doesn't work as quickly as magnesium, but it can be incredibly supportive and helpful.
Hmm. And you were going to go on to lithium.
Yeah, the lithium is, it's been my kind of life's work, helping people understand this natural element called lithium. So we have books, we have courses, we have articles, but I'll summarize it. And it's an important chapter in the ADHD book. The summary is that lithium is a natural element in the earth. It was one of the first three elements formed in the Big Bang when the universe started 13 billion years ago. It was hydrogen, helium, and lithium. And then in the Earth's crust, so when the Earth was formed about 4 billion years ago, lithium was in the Earth's crust. So it is essential for brain function. So we think of this medication that people take for bipolar at very, very high dosages, but at micro dosages, we cannot live without it. We mostly get it from water because it's in the rocks and it leaches into the water supply. So for drinking tap water, we get some lithium, and it gets into some of our soils. So some of our vegetables have lithium. It is important, one, and this is not ADHD, but the research has shown from probably 30 years now, the amount of lithium in the water around the globe where you live is predictive of mental health problems, particularly suicide. So it's quite dramatic, and it's really important that people understand that. So we have studies looking at the amount of lithium in your tap water. We have studies all over the world, from you know Germany to England to Japan to all over the states to Greece. I think 13 or 14 countries, and everywhere that we've looked, the lower lithium in the drinking water, and it could vary like different parts of the states, different parts of a country, the lower levels of lithium in the water, higher rates of suicide and mental illness. And again, not one study, hundreds of studies, all confirming the same thing. So we know lithium is important for brain function. And what we found, and what I've been writing about for many years, is this a symptom that we see in some of the irritable, kind of hyperactive ADHD kids, more males, so adult males and children, this aggression or irritability. When that's a component, that's a subset of ADHD individuals that respond very well to this nutritional lithium.
Where do you get nutritional lithium from apart from your tap water, which my understanding is is chlorinated and added. There's other additives to it as well. Um, can you speak a little bit more around that one?
Well, I guess like everything else, Amazon, you can get it on Amazon. I mean, it's a nutritional supplement that many companies sell. And, I recommend the lower dosages, the 1 to 2 milligrams. There are some companies that sell 5 and 10, but I recommend people start at the lower dose. Around 2 milligram is what the average person might get just from their eating and their drinking tap water. So it's a nutritional supplement that's simple and safe at those low dosages.
In bottled water, does that confer the same lithium amounts?
No, I mean, there's a couple companies that are bottling lithiated water. Um, but no, most filtered water would take out the lithium, and I believe that's might be an issue with what we're seeing, because I've been looking at testing lithium levels in people's hair and hair samples, doing that for many years, and the amount of undetectable low lithium has just been increasing, I think, since we started drinking with bottled water.
Mhm. What's been the most surprising thing for you over your career, from ADHD to other mental health considerations when it comes to your functional medicine approach? What has been the most astounding finding, or the astounding case that you may have come across?
Um, well, probably the most astounding part is the lack of recognition and dismissal from traditional psychiatry. I mean, to me, that is astounding, because we know the brain is the most metabolically active organ on the body. I mean, it's only weighs, like 2% of our body weight, but 25% of our metabolic energy is being used by our brain. And nutritional deficiencies, will affect brain function before physical manifestations. So to me, it's just amazing that psychiatry has been so resistant, because of the drug, pharmacy influence. That's the model that we have, and that's what we have all over the world. It's not just in the States. The psychiatrist's job is to prescribe medicine. The cases, I think the most dramatic I've seen is with lithium. And I would say the most thank yous, sincere thank yous that I've seen, and there are a number of them, on Amazon, and the finally focused reviews, parents saying that with the small dose of lithium, their child changed, from an aggressive, irritable individual who couldn't control his impulses or her impulses to someone who now had control.
Wow.
And that's the message of finally focused, that ADHD is kind of biologically based illness, and we need to address it biologically.
This is so interesting. There's so many things I'd love to unpack on what you've just said. The first one being the resistance in the psychiatric, or even the medical field, uh, because my sense is that that wasn't always the case. I mean, we were more holistic, being from a philosophical point of view. And when we look at understanding oneself from a more embodied point of view, that's trickled through over the millennia, from the ancient Greeks to where we are now. I mean, Hippocrates spoke quite a lot about uh, doing no harm. Isn't that the mantra of the medical field? When did this sense of, no, let's not look at this, let's only focus on this, come about from your understanding?
Well, I think the history of psychiatry is pretty frightening. To go back, because we didn't understand mental illness. From witches to demons to locking people up, to kind of people in the 1300s in England. People would pay money, like going to a circus, to see those with mental illness. Um, and then we did brain surgery, the lobotomies, and so we had no idea what to do. And then medication, the psychopharm revolution. So I think when we had some ability to control mental illness with medications, I think we forgot everything else. And so pharmaceutical companies now do all the research in psychiatry. Training is based on how to use a medication. New medicines come out every year, and that's just what the field of mental illness, or the treatment of mental illness, has become.
Yeah. And I came across, I can't remember his name now, but a number of years ago, there was a psychiatrist in the States who from a freedom of information request, got all the submissions from uh, the psychiatric research into medications, comparing placebo with other types of medications, and which ones were published and which ones were not published. And this psychiatrist, or sorry, he would have been a psychologist. He made the comparisons that oftentimes placebo worked in most cases just as well as many different psychiatric medications for depression in particular, but even exercise worked 6 times as good as placebo at times.
Yeah, no, that is the frightening history, that when they were pharmaceutical funded studies, which they mostly are, they only print or publish the ones that are positive. Um, Congress actually in the states changed the law, so now they have to be published. They don't have to be in a journal; they can be buried somewhere. But absolutely, research came out about 10, 15 years ago that our antidepressants don't work much better than placebo, which means there are a lot of other things we can do to help our patients. Exercise, nutrition, mindfulness are all very powerful tools that probably work just as well. And if we integrate all of them, then we can really help.
And you do talk about exercise and mindfulness in the book. Can you speak a little bit more on that in its relationship with ADHD?
Sure. I mean, I think exercise, most people know, most adults know they feel better after they exercise. ADHD individuals more so, I think, because it can be dramatic that they can function, they can work, their attention is better. So many adults just their lives are around exercise, and the kids, um, not only they feel better, but parents notice a difference. So many ADHD kids are involved in sports. So that's pretty easy. And we do have to understand the neurochemistry and what exercise does to the brain. So, and you mentioned depression, exercise is probably our best antidepressant. What was surprising to me when I started, and really nice to see the research, is the mindfulness helping ADHD. Because you think of a hyperactive child not being able to focus, not being able to sit there, and but we have great research now looking at mindfulness. In terms of exercise, I think one of the things that bridge physical exercise with mindfulness are the martial arts, which we have found particularly good for kids with ADHD, all different kinds. But the mindfulness, which is just an awareness of the present, helping people kind of just be aware of the present, can be very helpful. And for the ADHD, and we talk about it in the book, it's not necessarily having the child sit in a room meditating. It is can be walking mindfulness exercise. Walking through nature has been shown to be helpful for ADHD, and it's really the art of helping these kids just be aware of the present, of their surroundings, can be incredibly helpful for their attention.
In my clinical practice, there are some adults and even kids that I've come across who cannot sit still to do the traditional mindfulness, so the kind of meditative practice or breathing or whatever. I recall a recent client that I'd seen who any type of breathing exercise was out the window because it's kind of like, nah, they never work. So what I was able to do was, uh, with the help of another colleague of mine who taught me some Tai Chi exercises, is to pair the breathing with Tai Chi movements. So that when you're breathing in, your hands are moving in a particular way. When you're breathing out, your hands are moving in a particular way. Is this the type of stuff that you're talking about when you think of martial arts and when you think of other types of movements?
Yeah, yes. I mean, I can't tell you for many years, 30 plus years, parents that have gotten their kids to martial arts, the kids can't sit still in class, can't sit still at home, can't sit still at a friend's house. But in the, whatever it is, Tai Chi, Taekwondo, any of the martial arts, that they are able to kind of focus and listen and participate, um, and do really well. And their attention improves over the course of, their program. So yes, absolutely. It's that kind of movement, that breathing, and that awareness.
Do you know what it is, from a neurobiological point of view? What uh, martial arts does for the brain?
I not particularly. I mean, I think it would be probably around the research that we have on mindfulness, which is kind of this awareness, and we know mindfulness exercises can change both the structure and the function of the brain, and that's been studied. So I think my understanding of martial arts that it probably is um, this awareness. So the thoughts are in the present, and that we know can be incredibly um, helpful for brain function.
Mm. This is fascinating. This is really exciting because not only do we have meditation, martial arts, not only do we have nutritional deficits and add-ons, uh, we have a more holistic understanding of how these work together to help a person move forward. You've talked about a few things that you can add to your day to day, what you take and what you do. What are some of the things that you would advise to take out of your day to day?
Well, that gets a little more complicated. I think the most common one we see is actually copper. So copper is in the pipes and in most the water, certainly the older pipes, and that can leach out into the water supply. And so there are kids that have very high copper that can contribute and look like ADHD. They're particularly hyperactive. And the kids with high copper actually don't respond well to medications. So, high copper is one that can be tested for and treated. The other one is particularly for the younger children. Some of these kids that I've seen that are kicked out of preschool, these 3, 4 um, young kids, food allergies. So, food sensitivities, most common is dairy, wheat, peanuts, eggs. Um, those can contribute. So, that's a minus. And there are other kinds of heavy metals like lead. Um, we test for lead for young children in the States, but after they get a few years of age, we stop testing. But it is still prevalent, and it is a very, very common cause of ADHD that's completely ignored.
And which ones have you found to be the most damaging for a person who struggles with attentional issues or behavioral issues?
Well, the lead is just kind of more complicated because oftentimes we see it too late. The food allergies, if we treat these 4 or 5 year olds early, it's very gratifying. But the high copper is probably the most common that we're seeing because those kids, again, don't respond to traditional treatments. And that's how they get to our clinic. And we do hair testing and we can find these very high copper levels.
You talk about a pretty dramatic change in a child who stopped eating cheese in the book. Um, do you recall that case in vividness, if that's a word?
Yeah, no, we have a number of cases of individuals with certainly dairy. Um, they can actually crave the food that they're allergic to. So oftentimes they're eating it throughout the day, has a very calming effect for them. And so I've hundreds of, or it's not thousands of cases of young children with irritability. They typically have kind of red face, red earlobes, red cheeks after they eat the food that they're allergic to. So it's easy to spot with the black circles under their eyes. So by just eliminating those foods, we get pretty significant changes in behavior.
Mm. Changing gears a little bit for people who haven't been diagnosed with ADHD, but other people have pointed out, hey, you don't pay attention, or you can't remember this, or this or that. What are some of the signs that adults and kids can kind of look at in their own behavior and their own day to day that kind of signals, hey, there's something more to it?
Yeah, I think it's really important that there's not a test for ADHD, and some people go get psychological testing, and you're sitting one on one with a psychologist, um, and sometimes they can diagnose it, but oftentimes they can't because ADHD is a clinical diagnosis. And the most important thing I can share is that the symptoms are dependent on the environment, right? And so the symptoms of inattention, impulsivity, a poor impulse control, and overactivity, somebody might just have one component, someone might have all three. So it's really important that, if someone says, like, particularly for females, they've never been hyperactive, they're just inattentive. Actually got an angry letter from, I think it was a therapist recently. He said, why aren't people talking about inattentive ADD? Because many people just have that attention problem. So if difficulty inhibiting behavior, so impulsive, and that could affect eating, that could affect social skills, inattention, and overactivity. And that could be, the first and second grade of the overactivity might be squirming and sitting and moving around. But as we get older, it becomes more an internal sense of restlessness. So we're not jumping out of our seat if we're 19 or 22, but we feel that internal restlessness. I would say the most overarching way of describing all those symptoms is persistence of effort, difficulty following through, unable to kind of persist, with an effort. So you kind of always think of yourself as a failure, giving up, because you're just not able to follow through all the time.
Mm-hmm. Wow, there's so much to consider in that one, and I've got so many lines of questions, but so little time. Let me ask you just a couple extra things when it comes to relationships. People who haven't attended to their ADHD or changed that. How does that affect relationships with parents and so a child with their parents as well, and an adult with their partners and their children? How can that come about?
Yeah, I think a very, very important question, because the reason why I'm so passionate about getting this information out there, because untreated ADHD, higher incidence of substance abuse, divorce, financial problems, poor job performance, and motor vehicle accidents. So not treating ADHD is devastating. It becomes, for parents, they if they don't understand ADHD, they just see it as a child just misbehaving. And it's not, it's a medical disorder. They're not trying to irritate you. They cannot sit still. They can't finish their homework. They can't stop interrupting. They can't wait. And when parents get in this cycle of just criticizing and getting angry, it just has profound effects on self-esteem. So if you can imagine, the 6-year-old is hearing, I'm no good, I'm stupid, I can't finish, my parents are mad at me. And if that goes on for 10 years, it has profound implications for development. And then relationships, for spouses, it is just devastating for marriages when individuals aren't diagnosed, or people don't understand that somebody has ADHD. And as soon as you understand it, you can, both appreciate the strengths of ADHD, because there are a lot of strengths. These are passionate, creative, fun people. But if you don't understand the strengths and only focus on the weaknesses, your word is just really important to understand. Relationships with spouses and parents, siblings, and friends can really be destructive.
Yeah, picking up on that one, what is really engaging with a person who has ADHD, perhaps as an adult, that may attract somebody else, that they're very passionate, that they're very gregarious at the center of the party, and that sort of stuff. Whereas when they get into relationships, the deficits or the issues can tear a relationship apart. That's a really interesting point you've made.
Absolutely. And I think couples therapy, just helping people understand it, is half the battle, and then treating it. And the book Finally Focused, there some of the treatments are excellent for adults. Sometimes adults respond much better. Um, and there are some adults who might need medication if their ADHD is really impairing their job performance or their relationship.
Mhm. One final question I'd like to run by you. In my clinical practice, I've come across people who use methamphetamine or other types of amphetamines, and they say that these effects for them have a completely different effect than somebody else. It actually calms their brain down, and they can actually think for the first time, rather than other people who take a methamphetamine and their behavior is out of sorts, and so they use it as a medication, so to speak. Do you have any insights around methamphetamine and ADHD and that sort of stuff?
Sure, it's the same mechanism that our medications work in terms of increasing the release of dopamine, the chemical that kind of helps us with motivation um, and persistence and the rewards. And so that is part of the neurochemistry of ADHD, is this kind of deficiency in how dopamine works. So that's why ADHD individuals are very good if they're really passionate about something. They might be able to read car magazines for 6 hours because they love cars, but they can't read a history book for 5 minutes. So their brain can focus because they're producing a lot of dopamine. And it's amazing what interest people have that will produce that dopamine. But methamphetamine does it very quickly, and absolutely, they're going to feel better. But there are obviously medications and other natural means, because methamphetamine works so quickly. The crash is destructive. But there are other medicines and other ways of supporting dopamine to treat the ADHD. But it makes perfect sense.
Hmm. And on that point, and in closing, there's a monoamine that I came across relatively recently, especially with my discussion with James Fallon, monoamine oxidase A, which can interfere with how dopamine is taken back into the neuron after it's been released. So there's an overabundance of dopamine in the brain, and this can impact hyperactivity and even psychopathy in various individuals. Is there anything similar in terms of monoamine differences with people who have ADHD?
Well, I think that as we learn more about genetics, and there's genetic testing, there's different genes that we can test for, that have to do with breaking down dopamine, like the MAOI, um, and COMT is another gene, and then there are genes for the dopamine receptor, that how it works. So there are many genes we can look at, and if we add up all those genes, we can get a picture of what the dopamine system looks like for that individual. And for some, it's really kind of limping and not as efficient as others.
Mm. Dr. James Greenblatt, thank you so much for joining me today and being so generous with your time and answering the questions that I've put to you. Uh, where can people find you if they wanted more information?
Sure. I mean, the ADHD book is finely focused, and that's available on everywhere. I think on Amazon, and the website is jamesgreenblattmd.com. And we have a series of educational programs and books for the consumer on different psychiatric illnesses.